Welcome to my video blog series. I'm Dr. Stephen Grinstead, and today I want to talk about exploring effective chronic pain management and the importance of not getting locked into a total biomedical model, and that is pills, shots, procedures, and surgeries. So we want to work with the whole person, biopsychosocial, spiritual, and that's what I want to cover in this video blog. Just a little bit about me. I'm managing my own chronic pain for many years, 1982. I've also spent over 20 years, it's now 23 years, developing the addiction-free pain management manualized treatment system and field tested it in many different places, including a triple diagnosis chronic pain restoration program in Camarillo, California. I've authored many books, including the ones here, and I've also been able to write many peer-reviewed articles and a lot of blogs about chronic pain, especially chronic pain with coexisting problems, including addiction. So what is a good solution? Well, I want to explore using the addiction-free pain management system for effective outcomes, for positive treatment outcomes. So the question I often get asked is, what is effective chronic pain management? So basically, the core components include the four quadrants: bio, psycho, social, and spiritual. Now, it's important that for some people, there needs to be some biomedical interventions, but that can't be the whole picture. We also want to work with the psychological and emotional clinical processes, helping the person manage their thinking and emotional management better. Non-pharmacological, the holistic approaches, and developing ongoing family and social support system is very, very crucial. And the glue that holds it all together is implementing spirituality. In this chart, you can see the four quadrants: bio, psycho, spiritual, social, and some of the different interventions for each one of the quadrants. The next several slides will be going into much more detail about this. So let's start with the biological. One thing that's important is diet, nutrition, and exercise, the big triangle, the triad. And with the exercise, it needs activity pacing. Easy does it, but do it. A good sleep hygiene plan is really crucial. Many people living with chronic pain don't sleep so well. Appropriate activity pacing and non-avoidance, or stopping avoiding being active in your own life. Good physical and dental hygiene. An appropriate recovery-friendly medication management plan. In addition to that, we want to have different types of health care: hydrotherapy, massage, acupuncture, yoga, chiropractic, stress management, relaxation response training, breath work, eliminating and reducing nicotine, caffeine, and sugar. These are all some of the big pieces. Now, when you think about where you are in your life with these areas, with your biological, your physical health, I want you to score yourself on a 1 to 25 scale. 1, 2, 3 means you should be in the hospital. 24, 25 means you're ready for a marathon or other extraneous exercise regimes. So where are you at right now on that scale? So just jot that number down. Now, these are not the only things that are necessary for biological interventions. These are just some of the more common ones my patients have identified as important. Now let's switch to the psychological. This is the importance of learning how to better manage our beliefs, perceptions, thoughts, and emotions. Some of the things that are important here are looking for the inner saboteur, aka denial, looking at the defense mechanisms that help us until they hurt us, having better thought management, looking for those negative self-defeating thinking patterns and challenging them, getting real familiar and practicing when you're in a good place, meditation, hypnosis, self-hypnosis, engaging in therapy, counseling, or coaching, and most importantly, finding some daily balance in your life. One of the things I also believe is knowledge is power. Learning as much as you can about pain, recovery, and addiction or other mental health issues is really crucial. Learning how to identify, label, and manage uncomfortable feelings or emotions. Engaging the right brain through things like music, art, journaling, collage. External focusing or distraction. Avoidance by healthy distraction is a crucial pain management tool when I have a flare-up. And then cognitive behavioral restructuring. In other words, identifying problematic beliefs and perceptions, negative thinking, uncomfortable feelings, self-defeating or self-destructive urges, problematic behaviors, and social reactions or social interactions. Again, I'm going to ask you to score yourself here on 125. This time, if you're at 123, back to the hospital, but the psych unit. And if you're at 25, you've achieved enlightenment and you can hang out your guru shingle. Where would you score yourself on this score? Please write that down. Now let's look at family, social, cultural interventions that are really crucial. You'll be rating these on the same scale in a minute. So some of the things I find important in this area are making amends. You know, sometimes we need to clear up the damage that we've done, especially if we weren't interacting in a healthy way with other people, especially friends and family. We want to connect with our family or friends in a healthier way, learning how to set limits and boundaries, and by being proactive, not passive about your healing process. Always, always, always crucial to improve communications with friends and family. Letting go of people that might be encouraging you to stay stuck because maybe they feel sorry for you or maybe they don't believe you can do any better. I think you can, though. There's a lot of free resources, self-help meetings out there. Chronic pain support groups, Chronic Pain Anonymous, Pills Anonymous, just to name a few. Finding people who are accountability partners who support you in learning how to develop more effective chronic pain management. Finding safe places to go that don't trigger grief, loss, remorse, or tempt you to do physical things that you really shouldn't do because they could flare you up. And really, really important is learning how to have fun, especially having fun with other people. So again, on the same 1 to 25 scale, this time if you're down at 1, 2, 3, you're a hermit, totally cut off from friends, family, and culture. And if you're at 25, you're like a super social butterfly. So again, rate your score here and then write it down so you don't forget it. And then the glue that holds it all together, the spiritual. So a big part for me has been learning how to forgive myself and others, loving myself, improving my connection with my higher power, and this has to be different for every person, developing a spiritual practice on my own and with others, and participating either religious and or spiritual activities on your own or with others. All these are really important. Also, again, balance. A lot of people find their spiritual connection in nature. Praying. And praying is a really important two-part process. One is talking, the other is listening. Practice individual or group meditation. And if you're in 12-step program, working the steps, especially in Chronic Pain Anonymous. Now, again, it's really important to rate yourself in this area also. This time, if you're down at 1, 2, 3, you're totally cut off from your spiritual values, practices, and principles. And if you're at 25, you're in total harmony with your spiritual values, practices, and principles. So write down that number. Another thing I ran into years ago, 1988, was a system called Potentials Unlimited. It's self-hypnotic and subliminal instruments. So some of the topics I've used and most of the people I've worked with use, one is titled Pain Relief, Relaxation, Stress Relief, Insomnia, Self-Healing, Stop Smoking. And other titles can be added as needed. And if you want to order these, you can go to potentialsunlimited.com. I hope this was helpful today, helping you move out of the problem into the solution by exploring what effective chronic pain management is and stepping away from the total biomedical model. And thank you for joining me today. And please call me or email me at the links that accompany this video, and I'd love to know if there are other topics you would like me to cover in my ongoing video blog series.